Jeff Howden here with Bill Fisher. Bill, you're a doctor, but you don't want that in your title. You don't want it to be Dr. Bill Fisher. What sort of doctor are you?
I'm a family practice physician. I've done it for 40 plus years. When I introduce myself to my patients, I introduce myself, hi, I'm Bill Fisher.
Yeah.
And they can call me anything except late for dinner. I don't really care, but Bill's fine.
Yeah. And you are a direct primary care.
I am.
Do you explain what that is?
Direct primary care is a way of providing patient care the way I've done it when I first started medicine 40 plus years ago.
Ew.
It's just a different payment method with how the patients or clients, or however you want to refer to them, pay for my services. Instead of going through a third-party payer like an Aetna, Aetna, or whoever your major medical insurance carrier is, you basically deal with me, because in direct primary care, 90% of your healthcare needs can be provided by a well-trained family practice or internist or pediatrician that does direct primary care.
Yeah. Yeah. And so when you say that you did, it's you're hearkening back to like the start of your career. How's it similar, and what benefits do you see from that?
It's what I started with, and it's what I thought medicine was going to be all along. That's how it's transitioned over the past 40 years, especially the past 20, with the Affordable Care Act and people's deductibles going up higher and trying to get their insurance online. And now a lot of the big systems, what they do is they have urgent care centers, and if you can't get in to see your primary care doctor, you go see the urgent care, whoever's at the urgent care facility. And if they can't take care of it there, they send you to the hospital.
Mm-hmm.
Whereas I already said, most of your care can be provided by a well-trained primary care physician.
Yeah.
But those
Yeah.
are few and far between anymore, because now they work for these systems. And I'll try not to be too cynical, but I'm not a big fan of the systems.
Yeah.
I like this direct patient care where I can talk to you, you can talk to me, you have access to me, you have my phone number, you can call me up. You don't get an answering center somewhere.
Yeah.
You can probably get in today or tomorrow, maybe the next day if you absolutely, if I have to have a physical, that's not urgent. But if you call up and say, I'm coughing up my lungs and I have a high fever, short of breath, you need to be seen now.
Yeah.
And so you have very rapid access to
Yeah.
your primary care physician.
And it's rapid, and your schedule's not chock full of patients back to back to back, where patients don't feel like they get your time and attention.
Well, let me give you a little history. So, as I said, I've been doing this for a while. Before I I went to work for a system back in 2016. Prior to that, I was in private practice for 20 plus years. And I had a very large panel. I had 4,000 patient panel, which is a lot of patients.
Yeah.
They never got shorted. I made sure they got the time they needed and all that. But when I went to work for the system, they cut my numbers way back, but I had to spend a whole lot more time sitting on a computer.
Yeah.
Had to make sure this was done, had to make sure that box was checked, this box was checked, that had to be done, was this done? And if you didn't do that, then you had to do that on your own time after that next patient came, because when your time was up, then you had to see the next patient.
Yeah.
And that just wasn't how I did things.
Yeah. But yeah, I mean, you obviously are a people person. It seems like you probably love chatting with people and getting to know them. And
Oh, I do. I still have people, my nurses that come into the office and go, when I get 3 knocks, I know it's time. Oh, I've too much time, but the patients don't know that.
and what do you see your patients? What do you see the benefit to all this to them?
I get to know them. I know who these people are. A lot of them, I've delivered their kids. I've done deliveries. I used to do hospital work, and so I've taken care of full service primary care medicine, and that's how I was trained, and that's how I thought I was going to be until I was done practicing medicine. It has changed since, like I say, pretty much since the Affordable Care Act came in, and that would have been the late 90s and early 2000s. And it's harder and harder and harder to get access to your primary care physician.
Yeah. Yeah. And it seems like, based on your shirt and your personality, that you also make it a fun and welcoming environment.
I do.
Yeah.
You don't want to go into stone cold office that smells like alcohol, not the drinking type, but sterile in that you want to be warmly received and be comfortable with who's you're at. People walk in to see physicians and they tell them their life story, and they don't even know who you are, but because you're a physician, they just start talking to you. And sometimes you have to be careful to make sure your eyebrows don't go up like this and your mouth doesn't drop open like, oh, I can't believe you're telling me that. But
Yeah.
that's what happens just because you're a physician. That's just a special relationship to have with somebody.
Yeah.
And I'm sure other physicians do the same thing, have that privilege to be able to do that. But if you have the time to do that, that takes just that word, time. It takes time to develop that relationship.
Yeah.
Doesn't just happen.
Yeah. Yeah.
And now I have even more time than I did before, which was great.
Yeah. Sounds like it's all about relationships. Well, there he is, Bill Fisher. Thanks for joining me.
You're welcome. Thank you.